are the students from Parkland College Dental Hygiene Program, and today we are here to talk to you about problems that can occur with patients who are undergoing chemotherapy and radiation.
As cancer rates seem to continuously rise every year, it is more important than ever to know how to properly care for a patient going through chemotherapy and to understand what effects radiation has on the oral cavity. According to the National Cancer Institute, 40% of patients receiving chemotherapy develop some sort of oral problems. People who are undergoing chemotherapy are at a high risk of developing painful conditions in the mouth. Some of these conditions include xerostomia, mucositis, candidiasis, and a change in the way food tastes. Xerostomia, also known as dry mouth, is often caused by medications. Chemotherapy and radiation patients are at a higher risk because of the medications that are going through their bodies throughout treatment. It is important to understand the risks that go along with xerostomia because it can greatly affect a person's oral hygiene. Saliva flow is a big factor in reducing cavities, and without it, it can cause serious damage. Saliva helps wash away the bacteria that eats away at your teeth and causes cavities. Without it, the bacteria sits on your teeth for hours or until your next drink of water. Ways to help with dry mouth are products such as Biotene, Act Total Care, sugar-free mouth lozenges, sugar-free gum such as Trident, drinking plenty of water, keeping the oral cavity cold with ice chips or popsicles, avoiding sugary drinks and hot liquids such as coffee and tea. Signs of dry mouth that are most noticeable are dry lips and a tongue that looks cracked. Another side effect from chemotherapy is mucositis. It is painful inflammation and ulcerations that can lead to serious complications. The ulcers can be so painful that the person will avoid eating and drinking, which can lead to malnutrition. If symptoms persist and become too severe, radiation therapy may have to be suspended until further notice. Keeping the oral cavity under control can be helped by using a sponge stick dipped in a baking soda saline solution to remove biofilm. This is important because biofilm left in the mouth can lead to systemic problems. Candidiasis is a fungal infection that can happen from too much yeast that builds up in the oral cavity. When your immune system is lower during treatment, the patient becomes immunocompromised. There are different forms of this fungal infection. Some signs and symptoms are creamy white lesions, redness, burning sensation, and soreness, which can lead to difficulty in eating. It is important to note that patients going through chemotherapy can have worsened symptoms of this infection, and the lesions can be severe enough to spread to their esophagus. It is necessary for the patient to see a doctor to get antifungal medication to help relieve symptoms and fight the infection. Another common side effect of radiation and chemotherapy is the way the food tastes. Because of the medications used, a person's taste can temporarily change. When the tongue is in the field of radiation, the client may experience partial or full taste loss. This is because both good and bad cells are killed and can cause the good cells, which are responsible for taste, to die. Taste will return a few months after the completion of radiation therapy, but may be altered. Food can become painful and can taste like straw, making it unenjoyable. Ways to help patients manage is to support them and help remind them that it'll change several months after treatment. Ensure the patients that it is important to keep eating. They can add in ensure to make sure they are getting the nutrients they need. Before chemotherapy and/or radiation, one should have all restorative treatment done that is needed and a cleaning. As a person goes through chemotherapy, their immune system is weakened, which can lead to progressive problems in their mouth and the inability to fight infections. During and after chemotherapy, regular and frequent dental checkups are important. If a patient does acquire dry mouth from medications or mucositis, maintenance is important to ensure oral health is kept. At-home care is essential to help prevent the patient from being at a risk for such problems we have discussed. Regular brushing 2 times a day for 2 minutes, flossing daily, and an oral rinse will greatly help maintain a healthy oral cavity. Some signs and symptoms to look for with the person who has oral cancer is a sore in the mouth that will not heal within a minimum of 2 weeks and hardened or swollen lymph nodes in the neck or the jaw that persist. It is important to do an extra oral examination to palpate and feel for any abnormalities in the head and the neck region.
So now we're going to do the extra oral exam. We're just going to feel around to see if there's any lumps or bumps, any swelling, We're going to check the TMD, open, close, no clicking or popping in the jaw. Everything looks within normal limits, so you're good. We want to make sure that we check the extraoral exam so there's nothing abnormal or any signs of early cancer.
It is important to keep in mind the side effects of chemotherapy and radiation of the head and neck. Xerostomia can cause rampant caries if not properly controlled. Mucositis can be painful for patients, which may lead to malnutrition. Make sure your patient is aware that some of the medications during chemo/radiation can cause a change in the way the food tastes.
Thank you for watching our video about oral complications for patients who are undergoing chemotherapy and radiation. I hope this video was helpful.